keeping the heartbeat of the city healthy with health tips and benefits from real doctors in the area. This is Health Help.
Okay, today we're going to talk a little bit about the Zika virus and what it means for you, how much of the Zika virus that we are seeing, and what are the public health implications and things that you can do to prevent spread of Zika virus and or other mosquito-borne diseases. So about 2 years ago, we started seeing increased infections in Brazil. And these infections were particularly associated with birth defects, particularly brain anomalies in the children of Brazil. Last year we saw this disease basically explode on the North American and South American continent and actually moved into the continental United States involving Florida. Now, Zika virus is a flavivirus, which means yellow virus, in the same field as yellow fever virus, which we have a vaccine for. There's also chikungunya, dengue, that are other viruses that we've dealt with in the past. But this Zika virus is a little bit different in that it likes to attack the developing brain, particularly in pregnant women. So therefore, we've come up with a lot of recommendations for pregnant women and how to keep it from being transmitted to pregnant women. Thus far, we have Zika virus in 84 countries, and 31 of those countries have reported brain damage to a lot of the infants that are born to the born with exposure to Zika virus. Here in the United States, we've had last year close to 5,000 cases of Zika virus confirmed, and 1,700 of those cases were women. And with those women, we've had 56 live-born children with some type of birth defect, and we've had 7 pregnancies that were actually lost due to the Zika virus. So it's becoming an important disease, and we really want to prevent the spread because of this into the rest of our continent. In Tennessee last year, we had 64 cases, and we didn't have any children born with brain defects here in Tennessee. But we want to prevent that from becoming a regular case here in Tennessee or being spread on a regular basis here in Tennessee. So if we have current guidelines and recommendations, one is fight the bite, which means we need to protect yourself from mosquito bites. Particularly if you go to mosquito-infested areas, and especially those where Zika may be transmitted. It's important that we prevent mosquito-borne diseases, and there are other mosquito-borne diseases that can be transmitted through the mosquito. And Tennessee, of course, is in the Mosquito Valley, where we can see lots of diseases transmitted. The second strategy that we use in talking about Zika is drain and cover. And with drain and cover, we want to drain standing water, gutters, flower pots, any areas where water can stand and allow mosquitoes to propagate and develop. And then, of course, cover any water that you can't protect. So fight the bite, drain and cover. And then the third strategy, of course, is to protect our pregnant women. Pregnant women have currently been recommended not to travel to any of the countries that has endemic Zika being transmitted. And we actually have 2 areas in the United States where Zika transmission has occurred. That is in southern Florida, Miami-Dade County, and also in a small region in Texas. So we encourage our pregnant women not to travel to these areas. And then if you have a Another thing that's kind of special about Zika is it can be sexually transmitted. So we tell male partners, if they've been to a Zika-infested country, that they need to abstain from sex or use a condom. And especially if they have a pregnant partner, they need to abstain through the entire pregnancy. If they don't have a pregnant partner, then for 6 months. Zika has been found to be stored in the men's prostate and can live there for quite some time. Women, however, are 8 weeks. So once they get back from an endemic area, then they can resume sexual activity after 8 weeks. So what if you've been to an area and you want to be tested? Here in Tennessee, we have a decision algorithm that we go through that we determine who's going to be tested. Certainly, any pregnant woman who has been to an endemic area, is possibly symptomatic or asymptomatic in the pregnant woman, we will go ahead and test through the Tennessee Department of Health. And we'll also look for a couple of other viruses at the same time. That includes dengue and chikungunya virus. Other people who have been and have developed symptoms, so fever with conjunctivitis and or a rash, arthralgia, we will go ahead and test if they've been in an endemic area where Zika is being transmitted and have developed symptoms. There's also a unique thing about Zika in that 80% of people may not become ill when they're exposed to Zika virus, as opposed to chikungunya, 90 to 95% of people get ill with it. With Zika, a lot of people don't necessarily get sick with it, may not have any symptoms. That's why we check all pregnant women. 20% of people will develop the standard symptoms of fever, conjunctivitis, which is a little eye infection, skin rash, and achy joints that are the most common symptoms associated with Zika. If you've been to an endemic area, certainly pregnant, we encourage you to call the Tennessee Department of Health or our health department here in Sullivan County, and we'll be glad to work through the decision tree of should you be tested. And then if you need to be tested, we will facilitate getting your blood work and urine down to the state lab for testing. So it comes back to an ounce of prevention is better than a pound of cure. And certainly for our babies that are born with birth defects, we have no cure. So it's very important that we fight the bite. In other words, use insecticides to try to prevent us from getting mosquito bitten in the first place. That we drain and cover. In other words, decrease the environment around which mosquitoes can grow around our house. And you really don't have to do the whole farm. You really only need to do 200 yards within that are around where you live, because mosquitoes generally don't travel more than 100 yards from where they're born. And certainly we need to protect our pregnant women. So these are our 3 strategies on preventing Zika. We encourage you to stay in tune with local news agencies, particularly looking for where Zika may have been spread, particularly in the continental United States. The CDC website, www.cdc.gov, has lots of great information on Zika. And of course, we have some information on our website, www.sullivanhealth.org, that you're welcome to check and look for updated information. And that's our story on Zika today.